Hey guys, I recently did a piece about a mom named Linda Jones who, after having her babies, experienced not only breast engorgement, but armpit engorgement as well, which was incredibly painful. And I've received for a long time a request to do something on what to do about breast engorgement. So that's what I'm doing. All right, so breast engorgement, it's the most common in the early days of breastfeeding as your body tries to figure out how much milk to produce and when. And essentially, milk engorgement is the buildup of fluid and blood in the breasts, and it causes them to swell and to become really hard. It can also make them feel really, really tender and achy, and it can also make it hard for the baby to latch on because there's less nipple to attach to. So it can be frustrating for all involved. And before I get into what to do about this, I do want to note that it won't last forever. As your body gets used to your baby's demand for milk, your body will typically adjust its supply. And so, if you go longer than usual without pumping or feeding, your breasts might get pretty full, but it's typically not as intense as the early days of engorgement. They'll probably just start leaking a bit instead of becoming super engorged. So here is how to reduce the discomfort if you experience breast engorgement. Breastfeeding on demand. Helping breast milk, drain regularly reduces the swelling. You can self-express milk. If the baby this can be especially helpful if the baby has trouble latching onto the nipple. You can stand in the shower or even over the sink or the toilet, and you can just gently press on either side of the nipple, and milk will likely start to squirt out. And this can help to soften the breast enough to allow the baby to latch on. You can try block feeding. And what this means is you have baby fully drain one breast before you offer the other one. And this also helps to ensure that your baby gets both the foremilk and the hind milk that your body produces. So foremilk is like the thin, watery, lactose-rich component of breast milk, and it's the part that's really great for hydration and quick energy. And then hind milk, what comes after the foremilk, it's more creamy. It's the fat-rich part of the breast milk that provides more nourishment and contentment. It's what helps the baby really feel full. All right, something else you can do for breast engorgement is get in a warm bath or use warm compresses on the breast. That can also help to soften them. And when you're doing that, this can also be a good place to self-express. So you can do both at once. This is an interesting one. You can actually hold an electric toothbrush that goes against the breast to help to empty the lobes that contain the milk. So it helps to drain them out a little bit. While I just talked about warm compresses, you can actually also use a cold compress on the breast that can help to reduce swelling and pain. I like personally to use like a frozen bag of corn or peas because it's not too hard. You can also apply washed cool cabbage leaves to the breast until they start to wilt. That takes about like 20 minutes or so. You can also, if you're really experiencing a lot of pain, check with your doctor or your midwife, but they'll likely say that taking an over-the-counter pain medication like Tylenol or Advil could be okay. You can also start to massage your breasts, as this can help to shift the excess fluid and soften the breasts, but do not be surprised if milk starts to squirt out everywhere when you do this. You also want to I know this sounds, well, actually this makes perfect sense for breast engorgement. You want to stay away from foods that promote lactation in breastfeeding moms. So examples of the foods that you want to stay away from, at least when you're having breast engorgement, are oats, brewer's yeast, flaxseed, hummus, papaya, spinach, carrots, asparagus, salmon, and apricots. Of course, there's other ones, but those are the main ones that I know of. You also want to stay away from lactation-producing herbs like roasted dandelion root, fenugreek, blessed thistle, and red raspberry leaf. During all this, you also want to keep an eye out for mastitis, which is inflammation of breast tissue. It's usually caused by, a clogged milk duct or bacteria entering the breast. And it can sometimes lead to an infection. And symptoms of this often include a fever, like a red streaking in the breast, or really painful lumps in the breast. And if you experience that, let your care provider know. And if the issue of breast engorgement continues on and on and on and on and on, let your care provider know. All right. Thank you so much for watching or listening. If you can subscribe, like, all of that is incredibly helpful. And of course, please comment with any questions. I answer all of them.